Well, good morning, everybody. It is Monday, May 25th, Memorial Day. I hope everyone is getting some well-deserved rest. So I'm going to jump in. We have a lot to discuss this morning. So again, I do record these calls, and they are now available on YouTube. So if you do have a YouTube channel, go ahead and jump on there and subscribe to our channel. I am sending out text messages and emails, so you can click the link, and then once you're on the channel, you can go ahead and subscribe. It's pretty easy to do. If you need help with us with that, just let us know. We'll be glad to help out. Office hours this week, we're going to go back to normal Monday through Friday, 9 to 6 at our West Colonial office. Obviously, today is a national holiday, so we are closed today, but we will return to normal business hours as of tomorrow. So Tuesday, May 26th, back to normal, Monday through Friday, 9 to 6. So if you need kits, if you need anything, obviously we're still available remote. You can reach us by phone, email, text message, gun flare, pigeon, whatever it takes to get to us. We're here to help you on that. And then if you are physically in the area or you'd like to come in and get kits, just come on in. There is no restrictions right now. We're not open to the general public for clients unless they have an appointment, and so we're going to take it step by step as we open up. So again, our office hours, Monday through Friday, 9 to 6, we are back in business. We do have a training calendar, lots and lots of training. Again, if you don't have access to the training calendar, we are sending you a text message every week with a link to the training calendar, and that has all the trainings, whether they're remote. There's not a lot of physical trainings going on right now for obvious reasons, but there are a few trainings for this week. So no trainings as of today because of the holiday. Tomorrow, back in business at 2 o'clock, Advent Health is doing a webinar on how to use their new broker portal system, and that is from 2 o'clock tomorrow. And also tomorrow at 3 p.m., Humana is doing a WebEx on the Enrollment Hub and how you can do an online enrollment using the telephone. So that is Tuesday, tomorrow. Wednesday, the 27th, you have Aetna doing a webinar at 2 p.m. for their rate telephonic enrollment tool, and that is available at 2 o'clock on Wednesday. On Wednesday, also 3 p.m., Cigna is doing their telephonic enrollment tool training, and that is available at 3 o'clock. Also at 3 o'clock, Humana is doing a plan-specific email training, so how you can email all of your plan-specific information to your clients. That is at 3 p.m. on Wednesday, May 27th. Thursday's a busy day. Thursday, 10 a.m., you have a WebEx with Advent Health. They're doing another broker portal session. Again, 10 a.m. on Thursday the 28th. Also at 10 a.m. that day, Humana is doing a training on their telephonic enrollment options, so that's available as well. Same day, Thursday, May 28th, veteran training for Humana. They're hosting that at 12 p.m. So if you need to brush up on your veteran information, they have an incredible healthcare training available at noon on Thursday the 28th. Also, same day, the 28th, Cigna at 3 p.m. is doing a training on how to reach new clients with Benefit Checkup. That's an excellent tool that you can use to find resources and lower the cost and get extra help for your clients. So if you haven't checked that out, check out Benefit Checkup. Easy website to remember. But they'll do a training session on Thursday, this Thursday at 3 p.m., and that's hosted by Cigna. Friday, the 29th, Cigna is hosting another training at 10:30. Same training, how to reach your clients using the Benefit Checkup tool on Friday at 10:30. So that's the trainings for the week. I hope you guys take advantage of that. Again, you can bookmark that training session on your computer so you don't have to rely on searching for that and all these trainings. We put it all together for you. So I appreciate Tom and the team for putting that together for us. All right. Now, we are offering, if you need help, we are offering digital business cards. So if you can think of a physical business card, we are now creating digital business cards for all agents that are interested. Just send us an email, and we'll be glad to put together a digital business card. We do need to make sure that we have your picture on file. If we don't have your picture on file, please send a most recent picture of you, professional if possible, and we can get a digital business card for you to promote yourself on Facebook, Twitter, YouTube, or even in your emails. So wherever you're doing your marketing digitally, we can help you build a business card for you there. So that's a great tool that you can use to get out there in the community. I also want to roll out and remind folks of an agent referral program that we have. We started this back in January. We call it our 333 agent referral program. And the way it works is you get $300 if you refer an agent that contracts with health plan markets. They must contract with a minimum of 3 contracts. So any 3 carriers, such as WellCare or Freedom or Devoted. It could be any combination of carriers, so 3 of those. They have to do 3 sales within 3 months, and you get $300. So that's our 333 referral program for agents. If you do have an agent friend that's not happy where they are, or is even considering changing agencies, you can get rewarded for that. So just keep that in mind as you're out there talking to your friends about what we can do to help them this coming year as we grow and keep moving forward. I also wanted to remind everyone, we touched a little bit on this a couple weeks ago. We do have list services available. So if you're in need of a marketing list, for instance, if you wanted to do a mail out and you need addresses for seniors or for families in certain zip codes or counties, we can help you procure that list and send it to you. Some of these lists include addresses, emails, and phone numbers, which you can call or text. So when it comes to the phone numbers, we have to be a little careful on the do not call list, but we do have the ability to capture lists for you. So if there's certain places or areas, or if you have an idea for a marketing campaign, we can help you put together a marketing list. And so if you are interested in getting a marketing list, please let us know. Again, you have our contact information, and Mr. Sergio Diaz will help put together a marketing list for you. So depending on what you're looking for, just give us a few days and we can go ahead and get that list created for you. And then last week, I think I touched a little bit on the Google Translate app, and I wanted to touch on this a little bit more. So if you have clients that speak a second language, and maybe that's their first language, and they're more comfortable speaking in, let's say, for instance, in Spanish or even in Creole. Here in Orlando, we have quite a bit of folks that speak Creole. So if you come across a client that just prefers or maybe is a little bit more comfortable speaking in their first language, then the Google Translate app now exists in your text messaging. So if somebody gives you a call or a text message, you can use that Google Translate feature inside your own text messaging service. Now, I'm not sure if it works specifically with iPhones, but I do know that Android devices do have that already pre-built. If you don't have that, or if you're not sure if that works for iPhones, you can search on YouTube on how to set that up. It's pretty awesome. So I had a full fluent conversation with someone that was speaking a second language, and it was eye-opening to me. And I really thought that that would have been a great tool when I was out there selling, because I had quite a few situations where it would have been easier if I had that Google Translate text message feature there, so we can improve our communications and get down to the point. So check that out if you haven't checked it out. That Google Translate app can be a winner for you while you're out there in the field. We also have a person that is available to help with your Facebook campaigns. There is a cost involved in the Facebook campaigns. We're using Mr. James Cox at this time, but he has packages ranging from $100 a month up to over $1,000 a month, depending on where your budget lives, and you can invest in yourself and grow your business with Facebook. So he can help with your posts, your content, pictures, videos, and basically build out your personal stream or build out a page for you on your Facebook and drive traffic to you to make your phone ring. So if you are interested in that information, please let us know, and we'll be glad to connect you with James. Now, a couple of updates. Humana sent out an email last week regarding their agent of record Medicare tile, and what was happening there is Humana has a self-service portal, a personal URL that you can send out to your clients where they can go ahead and self-enroll in Humana. Well, that tile was missing, and there is an error there. And what's happening is if you did have that Pearl and you were sending it out, when your clients clicked on it, it would push them to their main web page, and you would not get credit for it. However, since that email has been sent out, they have fixed it as of May 22nd. So it looks like as of Friday they got that fixed. So just be cautious when you're sending out those Pearls. Maybe test them and go through the process to make sure that you're not getting kicked out to the main website or they're getting kicked out to the main website, because we want to ensure that you get full credit for your enrollments, because you will be the one servicing your clients. So just double check those links and make sure that they're all working. WellCare now has telephonic enrollment apps. If you haven't been following those emails, WellCare's been slowly releasing their remote enrollment tools. They now have a full telephonic enrollment tool, so you can call in with the member on the phone, and they will do the enrollment right over the phone for you, and you get full credit. Again, just make sure that you're on the phone with your client and that you're tracking that process, okay? Because sometimes that telephonic enrollment might go haywire or it ends up into the call center. So you just want to make sure that when you're on the phone that you're documenting it, you're getting an enrollment ID, a confirmation number, to ensure that you're the agent of record and we have a full and complete transactional record of that transaction when they're doing the enrollment online, and then we can go ahead and research it in case anything happens. But that's for your records, and so you'll be able to track your enrollments using telephonic enrollments. And that's pretty much across the board. So if you are doing those telephonic enrollments, make sure that you're reporting your applications with our Medicare app tool. It has an e-app confirmation number in there, so you don't have to write it down. You won't lose it. It's all right there in the system. So another reason why you want to report your sales, so we can help you organize that information and you don't lose it. Okay. All right. Looking into marketing, United Healthcare has released quite a bit of digital tools that are available to you right now in response to the COVID-19 pandemic. They've created some really great remote marketing tools such as flyers, postcards, advertisements that are already pre-built and approved. Even Facebook posts are created in those tools from United Healthcare. And so you can go in there and create your own marketing tools for remote marketing. So let's say you wanted to go in there and use a Facebook post that United Healthcare has already pre-created and pre-approved, and all you have to do is plug in your picture, your name, your phone number, and your contact information, and it goes ahead and it creates that ad for you, and you can automatically download it right on your device, and there you have it. You can go ahead and post it on Facebook or wherever you're posting it to. So those are all pre-approved. All you have to do is go into your United Healthcare portal, which is Jarvis. You just log in there and you'll be able to go in and find those tools under the marketing resource center that they have there, and you can start using those today. You do not have to wait for approval or send it up for United for approval. They are already pre-approved, and you can create them on your own and download them today. If you need help with that, again, we're here for you guys. Please let us know. We'll be glad to help you find those tools and build those tools out so you have them at your disposal. Speaking of United Healthcare, they have also sent out a notice that as of, it looks like May 1st, they are waiving all copays for primary and specialist visits for all clients across the board, across the nation, across all product lines. So specifically, United Healthcare is only covering the primary and specialist copays. They have not released any additional information at that time, but United Healthcare looks like they're jumping on the wagon as far as copays and making those void until the end of the year. So that's a pretty cool thing in case you have anyone that's currently on United Healthcare, or even if they are thinking about joining United Healthcare, they have the ability to go in there and join, and they won't have to worry about the primary care or specialist visits at least until the end of the year. So that's also there. All right. So last thing on my agenda today is last week I was answering some questions regarding, Part A and Part B, and when do I apply, and what happens right now if my members are coming to me and maybe I have a prospect that's still working or was working and now they are no longer working. They lost their job or their spouse lost their job. They don't have all of their Medicare parts, or maybe they haven't taken Social Security. So for some folks, this is really confusing because it's not just cut and dry. Before we were lucky where, somebody comes up to us and they have both Medicare Part A and B and they're ready to go. Well, you're going to come across folks that might only have Part A or maybe might only have Part B, but most of the time they just have A because they were working or their spouse was working and they were receiving employee benefits through their job or through their spouse's work. And so there was no need for them to take Medicare Part B because they have health insurance, and the health insurance is going to cover virtually the same things that Medicare Part B does. Well, if some folks were unlucky enough to be furloughed or lost their jobs, laid off, or even decided to take early retirement, then they're going to need that Part B. Now, the general rule for general open enrollment for Medicare Part B is most folks will have to go to Social Security, call Social Security, or go online to ssa.gov where they can apply for Medicare Part B between January 1st and March 31st. That is the general enrollment period for Medicare Part B. If they enroll or send in their application during that time, once it's effective, they will be sent their new Medicare card with an effective date for Medicare Part B for July 1st. Now, those are the typical general rules for enrolling in Medicare Part B. However, if a person is no longer working or a spouse lost coverage due to a loss of job, then those rules will create an SEP for that particular member. So let's say Mrs. Jones was enrolled in Mr. Jones' employer plan. Mr. Jones was furloughed or he lost his job, and he basically had his employer terminate his health care coverage. That would create an SEP for Mrs. Jones and Mr. Jones. If they don't already have Medicare Part B, they can now go to Social Security and apply for Part B. On the application, they would state that they recently lost coverage from their employer. They would need a letter from their employer which would have the date of their health plan termination on it, and they would have 60 days to enroll in Medicare Part B. And so they would send in to Social Security to get their Medicare Part B. Once they receive Medicare Part B, there will be an effective date on there. Typically, they would have 60 days prior to choose a Medicare health plan before their effective date. If it's a hurry-up situation, sometimes you'll get to your person and they don't have much time left, or they got their Part B and then their card came in after the fact. Sometimes that does happen. We can always submit an SEP for those folks. Remember, you have an SEP all the way until the end of this week, really, for June 1st effective date for the COVID-19 situation. But there are other SEPs out there. Specifically, loss of coverage is an SEP for those folks as well, so they'll have 60 days from their loss of SEP, from their loss of coverage through their health plan as well. So that's Medicare Part B. Now, the other question that comes up is, well, what happens if I was working and I didn't take my Social Security and I want to accept my Part B? Now, for most folks, if you have Social Security, they will automatically deduct your Medicare Part B premium. And this year it's about $135. They would automatically deduct that from your Social Security check before they made that deposit. Well, if you're not getting a Social Security check, they cannot deduct that Medicare Part B premium. So what happens in that situation? Well, if a person is waiving to accept their Social Security retirement benefits at this time, maybe they're waiting to defer it until they're 67 or even 70 when it maxes out, then they don't have to take their Social Security to receive Part B. They can still get Part B. However, they will have to manually pay their Medicare Part B premium. Now the thing is Social Security doesn't bill them monthly. They don't like to bill them monthly. They want to bill them quarterly. So they will get a bill in the mail, and it's going to be for 3 months. So whichever effective date they're in, let's say that they start their Medicare Part B on June 1st, they would be paying for June, July, and August up front. They would pay those 3 months, and their total premium would be those 3 months for Medicare Part B. So they have to pay all 3 months in advance, and they do have to pay it to Social Security in order to start their Medicare Part B. During that time, if they're not receiving their Social Security benefits, then if they miss a payment, then Social Security will shut off their Medicare Part B. So you have to make sure that your clients are well aware. It's just like paying their regular health insurance. If they don't pay their premium, they could get canceled from the federal government. So once they start their Part B, if they already have Part A, they now have their initial enrollment period, and you can help them choose a plan. So that's where you come in. So knowing this information is going to be really, really critical for you to help those folks that you bump into that are currently in the process of retiring, or maybe they lost their jobs right now and they want to go ahead and accept their Medicare Part B. Knowing this information is going to be really helpful for those folks so you can guide them on how to get to Social Security, how to apply for their Medicare Part B, and how to find a health plan that's going to fit their needs. All right? So that's what we have for today. I'm going to go ahead and open it up for questions. So if you have any questions. All right, does anyone have any questions this morning?
Justin,
no,
good morning.
Clear.
Good morning, Pedro.
Hi. Good morning. Listen, you mentioned 6. I don't know if I didn't hear well what you said, but understand that when folks, for example, when they leave an employer, they have 8 months. That step is 8 months for Part B. The SEP is 8 months. Do you understand what I mean?
So for Medicare Part B?
Oh, I'm sorry. I thought that I had the other microphone working. Okay. I said that I understand that if they leave the employer, it's 8 months that they have as an SEP to apply for Part B with Social Security.
8 months? They only have 8 months if they were eligible for Medicare Part A and Part B at the same time. They have 60 days to choose a plan if they leave their employer using the loss of coverage. Now, if they decide that they don't take their Part B, they have 8 months to avoid a penalty. After that 8 months, then they're tagged a 10% penalty for not having Part B. But they are void of that. They don't have to accept their Part B or they're exempt from that penalty if they have employer coverage. So that 8 months is basically there for their for the penalty. So if they decide to waive that Medicare Part B for 8 months, then then they do have to pay a 10% penalty unless they have employer coverage.
I see. Okay, very good.
Yeah, no, that's a great point there. So some folks will say, well, I don't need to have health insurance, and they don't have employer coverage, and then they decide they don't want Medicare Part B. After 8 months, then they get hit with a 10% penalty, and that 10% penalty follows them around for the rest of their life. And it's 10% every year. Once a year, they add another 10%. So if they've gone 5 years without having either employer coverage or Medicare Part B coverage, then that's a 50% increase on their premium, and that's the penalty that they have to pay until the end, until that's the end. So, but you're absolutely right. There is an 8-month window for them to choose Medicare Part B to avoid a penalty.
Okay. Thank you.
You got it. All right. Any other questions today? All right. Fantastic. I appreciate everyone for being on the call today. Again, we'll do this the same time, same station next week, Monday, 9 a.m. And I hope everyone has a fantastic Memorial Day. And be safe out there, guys. Have a great day.